Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragalmedical. This week we're going to be talking to you about our exciting new treatment option that we have in our clinic in the field of wound care. If you have a loved one that's at a wound care facility and is not getting the response to treatment or in an assisted living or skilled nursing facility, you're going to want to stay tuned. We've got some great information on how we can help your loved one achieve some better outcomes. Stay tuned. Okay, Dr. Mike, so we continue to advance and do cutting edge technologies in our practice, and since the beginning of this year we kind of looked into the field of wound care, and we looked into that because of our exposure to the field of regenerative medicine for our patients that are suffering with pain due to things like arthritis. So this is a really exciting aspect to our practice now.
Once again, we're trying to branch out and look at ways we can get all our patients to improve in all their areas that they're struggling with, especially when we see the patients with the neuropathy and aspects of, being overweight, being the arthritic knees, not moving as well. Some of these patients come in and don't have great sensation to their feet or their legs and develop these wounds that we're trying to help take care of.
Yeah, so for the average person out there, when you talk about wound care, what types of wounds are we dealing with? Are these more the diabetic foot ulcers and bed sores that we typically see?
Well, certainly in the outpatient clinic, we are looking at more the ulcers, the diabetic wounds that are kind of coming into play because the skin may be overstretched because there's edema or fluid retained into the legs. And then the lack of perception of a person who's diabetic, they'll break down and have a hard time recovering from those wounds because there's decreased blood supply. There's a illness in the walking and talking person, if you will, who comes into our clinic. But going into the facilities, again, being able to branch out and having our nurse practitioner go to these skilled facilities, then you're going to see some of those pressure wounds where a person's in bed and having a continuous pressure on their hip and their buttocks and their feet or heels, that we are seeing those pressure wounds as well.
Yeah, and so, I found it interesting as well, you have really two aspects traditionally, at most of these facilities, when we're talking about assisted living and skilled nursing facilities, or even if you're able to take your loved one to a wound care center, that's in the field of basic wound care. So what's the difference between basic wound care and then the advanced wound care that we're doing?
So if we think about basic wound care as the real preliminary aspects, just think about if you got a cut, you put a Band-Aid on it, right? So we're just covering that area of skin injury that actually allows that person to improve. But when we start thinking about basic wound care that needs medical management, we're starting to think about the skin tearing or breaking down, or the pressure also comes into play where we stage these wounds. Skin layer might be stage 1, getting into the fascial layer, again, stage 2. And there's a kind of a progression of staging. Yeah. We look at these wounds in a sense of the degree or severity of problem. So when we start looking at those conditions and not responding to the basic wound care of applying a bandage, putting some pressure wrap, making so the body can recover naturally, then we're getting into what's considered advanced care. And that usually means about 30 days later, you did the standard approach, you got the standard wound patches and the gauze pads and trying to clear the debris in the wound. And when that isn't really responding favorably, then we bridge into the chronic wound or so-called advanced care that we need to help these patients recover.
Yeah, because most of these patients, and you probably have a loved one out there too, because of all the complications with their health, they tend not to heal as well as they should be. They're not getting the blood supply to that area. And statistically, if a wound doesn't improve by at least 52% in the first 30 days, it's unlikely to heal in 12 weeks, and that's gonna run into other sorts of problems. So this amniotic allograft, this wound care patch, so this is neat because it kind of falls in line with some of the injectables that we do in our clinic. I kind of call it like a fancy Band-Aid because it really is. It has all of those properties that helps to, guide the patient into a better outcome.
Yeah, absolutely. So we have this film that's covered with these growth factors. It's donor tissue.
Yeah.
And so that is put into a film, and that's used as a covering for these wounds. So if you have a wound that's not recovering correctly or not fast enough, or the blood supply is decreased, and we're trying to help the ability for that wound to improve, we put these coverings on it that have these growth factors, that have these ability to help the process take place naturally. And our body does really, really well, but when you're ill, when you're in the nursing facilities, you've got swelling, you get decreased blood supply, maybe the nutrition isn't great. There's a lot of reasons that the wound may not really recover well, but these amniotic coverings really can make that difference to help them really get better.
Because essentially it serves as a barrier, right? And
Correct.
it has all of those growth factors and, positive things that are going to help to promote it in the right direction.
Absolutely, and that's what we're going to try to do. Identify those appropriate wounds to care for, and again, vet that person to advance into the ability to recover naturally.
Yeah, folks, if you have a loved one that is being currently treated at a wound care center or is in an assisted living or skilled nursing facility, you're going to want to give us a call to talk to us about how we can help your loved one, have a better positive outcome from their chronic wound. More information can always be found about our practice on our website at maragalmedical.com. And please consider subscribing to our YouTube channel. We've got a load of patient education videos on that we constantly update. Well, that's it for today. I hope you have a great day and I hope you learned something. Have a great day, everyone.
Bye now.